good morning to all of you present here and for all those who are connected live through our Zoom and Facebook app. So it's a pleasure today to introduce to you Mr. Harish, who is the Deputy General Manager of the Department of Optometry at Dr. Agarwal's Eye Hospital. So he's got a very vast profile and it's really my honor to read these things about him, which probably I just came to know today. So it was really nice, going through his CV. So he had his bachelor degree in ophthalmic sciences from AIMS, and he did his fellowship from optometry from the L.V. Prasad Institute, Hyderabad, and he also has a master's in business administration from the Pune University. So and passed that too with distinction. And a varied job profile. He was a lens consultant at Solar Opticals, the business development manager at Global Opticals, the sales and professional affairs, taking care of that in Johnson & Johnson, and the business development manager with India with Optomed, the assistant vice president for Center for Sight, the regional sales manager, Northeast with Hoya Lens, and ultimately landed up with his job in Agarwal, and he's been here since December 2014. So it's a pleasure to introduce you all to our group. And coming to today's topic, it's about dealing with how do you improve patients' life with low vision aids. Often when we see a patient presenting to our clinic with a macular scar or a corneal scar or a retinitis pigmentosa, the patient comes to us with a lot of hope. But we sitting there as a consultant, we're just happy with the diagnosis and we wouldn't know how to proceed further from the diagnosis and how to counsel a patient and what can be given to the patient furthermore. So we think that's the end point, but it's definitely not the end point, and we need to know more so that we can explain more to the patient at our OPD itself and then refer to our optometrist. So here, Satika, who's the optometrist, is taking care of low vision aids. The patients who are referred from the branches and of course various places do refer to our low vision aids clinic, which is taken care by Sajita, who's also handling our contact lens, and our ocularist. She's also an ocularist. So right this, with now we'll just move on to our talk for today. So I call upon Mr. Harish to do now this. Thank you.
Thank you, Doctor, for the generous introduction. So today's topic, which we'll be understanding as well as speaking, will be about improving lives with low vision aids. So what is low vision? Before we go into that, what is low vision? India is defining low vision as visual acuity between 6/18 and 6/60, or a visual field of less than 50 degrees. Functionally, if you ask me, any person who is not satisfied with his current vision is a candidate to be referred for low vision assessment. As an example, professionally, he may be a watch mechanic. So his vision may be normal, but he is unable to function. So functionally, any patient requiring a better vision can be referred for various devices. The patient examination for a low vision is also similar to a normal patient in terms of patient history, visual acuity, binocular vision, refraction, fundus examination. But very importantly, we clinicians many times miss out that field is also very important aspect to understand what is the required or available visual field for the patient. Generally, we find that the majority of the patients who come to our clinic have the issues of either macular degeneration, dystrophies, glaucoma, diabetic retinopathy, RP, or trauma. These are majority of the cases who get referred to the clinic. The problems that the patients face are distance vision, near vision, side vision, or the visual field problems, the psychological and other difficulties. If we really take a look, these are the entire visual aspects. But if you, as we go through the other slides, you will understand why we are trying to divide the vision into such aspects. How do we start? So these are the simple formulae to help you understand how we can start. As an example, for distance, in case we know the exact required vision by the patient, we can do the calculation for the starting point of magnification. So as an example, in this case, we have taken a current vision of 6/60 and we want the patient to be corrected to 6/18. In such a case, the starting point would be 3 times magnification. For near, the Kestenbaum's method, wherein reciprocal of the distance visual acuity will give us the dioptric addition that will help the patient in getting the near vision. Distance vision problems. Let us understand and divide them further. Difficulty to identify people or objects, difficulty in terms of taking notes from the board, difficulty in watching television. Each of these tasks entails a different environment and different tool will be required or best suited for the patient. The commonly used devices which we are dispensing currently are the Ocutech devices, portable video magnifiers, the telescope, spectacle mounted telescopes, Max TV, as well as handheld telescopes. Let us understand each of these devices further. The Ocutech devices are offering 2 to 6 times magnification when being used monocularly. In case binocularly any patient wants, then it offers a maximum of 2 times magnification. They are cosmetically much better and patient's acceptance is better compared to other devices. Recently, an automatic focus has also been launched. These devices are currently with manual focus for the distance vision. Portable video magnifiers, they function in a similar manner as in case of a mobile, but they have the added advantage that you have various contrasts so that patient can look at the image better. If you ask me, these devices are useful for distance when you want to look at a specific object. You can click a photograph easily, zoom it, view it in various viewing methods, and then read the object. Telescope. So this is a binocular telescope offering 4 times magnification. The benefit being that you can adjust the PD according to the patient's requirement. Offers pretty good image and a balance of visual field as well as magnification. These are the 2 types of telescopes. So there is also spectacle mounted telescope which can be binocular as well as monocular, but they come with a fixed PD. The benefit being that they are very economical compared to an adjustable PD. Max TV and CTV, these are again very popular devices which patients find it very useful and comfortable to use. They offer 2 times magnification, and the difference between the 2 devices is, in case of Max TV, the focusing can be changed monocularly, while in case of CTV, both the objective lenses are attached, due to which the focus can be changed only binocularly. Handheld telescope, portable, very comfortable, offering a magnification of 3 times to 8 times. So for a patient or for a child wanting to look at the board, this becomes very convenient. For an individual who is walking and wants to look at a distance object, this becomes very convenient. He can take it out, view it, and place it back. The difficulty is for a long term or a longer use while moving around. Near vision problems. So the near vision problems can be in terms of reading books, difficulty to do near tasks like sewing, reading menu cards, difficulty in placing signature. So for the common devices that we generally find patients are inclined are portable video magnifiers again, the illuminated stand magnifiers, hand magnifier, pocket magnifier, desktop magnifier, spectacle magnifiers, stand magnifier, as well as CCTV. Excuse me. Portable magnifiers come in various dimensions, ranging from 3.5-inch screen size to nearly 15 inches. The most popular that we feel has been in our practice is the 5-inch, which offers a sufficient magnification zooming capabilities along with visual field. As the screen size increases, the cost of the device keeps increasing drastically for the patient. Illuminated stand magnifiers offer a very good solution for the patients for reading as well as writing. They are coming with a fixed focus and are placed at a fixed distance, because of which it becomes easier for the patients to use the device. Illuminated magnifiers can also come in varied shapes, as in case of this mouse magnifier. So they come in with various shapes. Depending on the patient's requirement, we can select a device which is suitable for the patient. Stand magnifiers, they come with a very small field of vision compared to the illuminated magnifiers. It becomes very easy tool for the patient to read. So for the patient, he just needs to move the stand magnifier across the textbook or the reading material, and it becomes very easy for the patient to use this. These are one of the most popular as well as common devices, the handheld magnifiers. Not only in terms of low vision aid patients, but I have seen many elderly people carrying it one along with them or keeping it at their house for reading any prescription or any other small font, and they use it as per their requirement. So they can come in various shapes, with illumination, without illumination, etc. The difficulty with this device is for doing long work or reading for a longer time, it becomes very difficult. The second problem is you need to be having a steady hand to be able to read it, to have the objects in focus for the longer duration. Pocket magnifiers, they are portable and comfortable for the patient to carry. So as an example, in case someone wants to really go out, read the menu cards, etc., these become very convenient and handy compared to even handheld magnifiers. Desktop magnifiers are the ideal device for a patient with a profession or having to do any task at a specific location. So in such cases, the distance can be modified, and the biggest benefit is both the hands of the patient are free. So the patient can work as per the requirement. These are the most popular devices which we find patients taking them regularly, because patients find it more acceptable cosmetically. The spectacle magnifiers come from a power of 5 diopters to nearly 25 diopters. They are also coming with prism so that the patient can do near work for a longer time. The biggest difficulty with these devices is as the power keeps increasing, the patient has to hold the textbook or the book pretty close to him. And in such cases, the illumination can become a problem. The neck posture can become a problem. CCTV is the electronic magnification system for reading and writing, provides magnified image onto a monitor screen. It consists of three main components: camera, monitor, and a movable reading platform. But it offers a huge zooming capacity, and the disadvantage of this device is it generally becomes fixed to a particular location. It is not portable. So in case of anyone wanting to do office work in a specific location or at home, this becomes convenient. This is a non-optical device, signature guide or the typoscope. It consists of a durable plastic, black plastic or a cardboard, basically which helps you to cut off the glare from the remaining page, number one. Number two, the added benefit is for the patient to really track the line that he is reading and move it accordingly. It provides excellent contrast compared to the remaining page. The other devices are the letter writing guide, signature guide. Notex, it used to be very convenient and useful in India for the patients to understand what currency is he handling. Now with the newer currency being similar sizes, they are not of real use. But in different countries, depending on the currency sizes, you can certainly come up with your one's own Notex. The side vision problems. It can result in bumping and with the objects in the side, spilling of things, difficulty to use. Sometimes it can also result in diplopia. One of the best tools to correct such problems are the Fresnel prisms, which help in relieving the double vision. So the Fresnel prism will not be placed throughout the spectacle, but a part of it will be placed so that it becomes easier for the patient to access the blind area of his visual field. The disadvantage can be depending on the prism strength. There can be distortion as well as chromatic aberration. The other problems can be in terms of glare, color vision, and also difficulty in terms of night driving. In such scenarios, the absorptive sunglasses or the various filters become very useful to improve the contrast for the patient and can help the patient do a much better work. This is a synopsis of the various tasks that the patient generally may be doing and what may be the ideal optical device as well as a non-optical device. So most important point we need to remember is that a single device may not be sufficient for the patient all the time. So depending on the what task the patient is undertaking, a device will have to be given and advised accordingly. Let's look at some of the newer devices. MagniLink Zip. It is similar to CCTV, helps in magnification for documents. It has the optical character recognition also. It comes in two sizes, 13-inch and 17-inch. It is portable. So compared to a CCTV, any individual wanting this device can use it for various locations as well as carry it with him. Second device is MagniLink S. It offers a tremendous zoom-in capacity of nearly 75 times. It has an HD camera with output onto a laptop or an LED screen. This can correct for distance as well as near. This becomes very useful for children even when they want to go to school because this is portable and the patient can look at the distance blackboard as well as what he is writing. So this is a very useful tool in my view. Ultrasound Cane. This has been recently launched and this is very useful. Compared to a normal cane, wherein there is a difficulty in terms of how the patient can move because he doesn't know at what distance the object is till the cane reaches the object. In this case, using ultrasound waves, the settings can be changed for indoors as well as outdoors, wherein the user is alerted for a distance of ranging from 1.5 feet to nearly 3 meters, depending on the distance of the obstacle. Further, it gives out auditory as well as tactile signals to the user in terms of the distance of the object. Wearable devices. These have become more and more popular with the WhatsApp videos. Many a times patients are keen to understand what are the devices available. So there are 4 devices which are available in India. One is the eSight, second is New Eyes, A-Sight, and OxySight. They are offering a magnification from around 18 to 24 times. The biggest difficulty with these devices being the support for the device, because these are electronic devices. In case of any problem, it creates major issues, number one. Number two, in case of these devices, cosmetically, they are not as unobtrusive compared to some of the other devices. So the patient's acceptability, even today, it is very limited. Third, the cost is very high because they are imported. So let's understand and discuss some of the cases to understand how we are dispensing and what are the main points that need to be kept in mind while dispensing the low vision aids. Patient 1, 54 years, male, who is a clerk, having both eyes optic atrophy. He is working in a government office. His requirement is being able to read the bills. he needs to copy the numbers from a chart onto another chart. So his vision was 5/60 and n/24 with the spectacle correction. So we did a trial with the spectacle magnifiers as well as CTV as well as a video magnifier. Finally, the patient went ahead and took a video magnifier because he wanted exact zooming and the ability to change the zooming depending on the font size. Second individual, 57 years old male working in defense, right eye optic atrophy, left eye, retinal surgery was done. Patient is living alone. His requirement is he wants to see the bus numbers when he is traveling. He is unable to depend on anyone to help him while traveling. So when we did the trial for distance with monocular telescope, CTV, as well as spectacle magnifiers for near. Finally, patient went ahead and took a Ocutech glasses because he felt it is cosmetically much more acceptable and the ability of him to focus was better compared to a monocular telescope. He was having handling problems because of which he wasn't able to see through the monocular telescope. Third patient, 9-year-old child, student, having cone dystrophy. Her vision with correction was 5/60 in the right eye and 6/36 in the left eye and n/18 in the left eye. So patient was able to manage the near tasks by holding the book set much closer. So n/8 at 25 centimeters. Okay, doesn't want any device for near. Her difficulty is she wanted to see anything which the teacher is writing on the board in a better fashion. So we did a trial with Max TV. The child was very happy. She was very delighted. Parents were not really convinced because parents felt that she will be teased or the teachers can cause any issues. So we counseled the parents that they need to go across to the class and she can use the glasses only while she is reading the board. The second major problem was even though her vision was 6/36, in the glare she was unable to manage. She had got the glasses made. So we went across and helped her in selecting the right frame, which are much broader temples and a wraparound, so that there is no outside light during bright sunlight which is falling. Third, ensure that the glasses are tinted dark, and they were very happy. So she became mobile outside, even though her vision was 6/36. Earlier, she was not able to move outside. Fourth patient, 48 years old, teacher. Her main requirement was reading books. Her vision was 6/60 and near version was n/18. Her requirement was she doesn't want any device for distance. She doesn't want anything to be seen or anyone to know that she has a problem. Secondly, her requirement is she wants to correct the examination papers in a faster fashion without errors. That was her only requirement. So she went ahead and took spectral magnifier with which she was comfortable and she felt that there will not be an error while she is correcting the answer sheets. Fifth patient, 53 years old, security guard in bank, and his vision was 3/60 and 6/36, n/36. So his requirement was for near only. So we gave spectral magnifiers as well as the Ocutech for distance, and finally patient went ahead with only with spectral magnifier. His requirement was entering into registers, maybe receiving couriers. One of the important aspects which I did not ask him though was, being a security guard, how are you going to identify the patient's faces? But he was clear that he wanted something for near alone. Last patient, optic atrophy. His age is 25-year-old male, reading books. His vision was hand movement. I did not expect any improvement in his vision with any of the devices. So still we went ahead and gave a trial. With the video magnifier with effort, he was able to read n/48. but he wasn't satisfied and he did not take any device. So one of the most important aspect which we need to remember is that while dispensing, we need to really dig deeper into what the patient is requiring, what does he want to do, and what device will be most suitable. And then we can go ahead and dispense, and that's the way we can ensure that the patient is satisfied. Thank you.
A big round of applause really for Mr. Harish for just going through such a detailed manner, and the slides too, like very crystal clear, the pictures, and not too overcrowded, just 4 lines for you to remember. It was a very, very impressive present. Thanks a lot, Mr. Harish, for that. We also have displayed the low vision aids over here. So people who are interested can come after the class and you can get to know about the various devices. Most importantly, the cost of all the various devices, because as he was telling, one is the cosmetic acceptability and the other thing is about the cost of those devices. So patients generally, have a, hindrance when it comes to the cost and the way it looks. So these 2 factors need to be considered. And I think as you were telling, a trial is very, very important to understand the patient's needs. It's only not about the visual. Just imagine, cosmetic needs are also much more important. So one-on-one talk with the patient will only help in, dispensing the right low vision aids for a patient. So with this, I'd like to ask, anyone has any questions? Yeah.
This is not about exactly low vision aid. I have a patient who's a doctor working in a very remote area. She does everything. She does small surgery. She does everything. She actually has cataracts and she wants to undergo surgery. But her requirement is she wants to be able to see the letters, the print in the ampules, the expiry date, and such small print she wants to see. Like whatever correction they give, normal spectacle correction or normal lens IOL, whatever we put, we try to correct for N6. But she wants something beyond that. So how do we proceed in this case?
So this is as an example what precisely what I was mentioning in terms of functionally requiring a better vision. So depending on the requirement, either we have to understand which location. So as an example, near vision, better vision for near in terms of fonts is required in a specific location, then we can look at desktop magnifiers or some of the other devices. In case she wants a portable device, then the device would change. What is the kind of illumination? So all these 3 becomes an important factor in determining what device will be best suited for her. So let's assume she is working, let's say, only requiring during the OT, she requires an additional viewing. Then either a desktop magnifier or a spectral magnifier will be sufficient. Good.
Okay. Anybody else have any questions? Okay. Which of the cases do you think will require a low illumination for a better reading? Which conditions for the most benefits? Then he was mentioning about illuminated devices, right? There are certain conditions where the illumination has to be low. Can anyone say which conditions do you think the illumination has to be low? I think you can take a guess. It's quite easy, right? Which conditions the illumination has to be low? Which one? Albinism, right? Aniridia, correct? Achromatopsia. These 3 conditions in which the illumination has to be low. So normally I was talking about all the cases of cone dystrophy and optic atrophy and things like that. We often see patients with retinitis pigmentosa, and it's like various levels of retinitis pigmentosa. It's not that they come to us only in the last stage, right? So there are different stages in which you can offer low vision aid. So how do you deal with a patient with RP who's coming you probably like just diagnosed? Do you think we should refer a patient to you? The patient has just been diagnosed with RP with just early peripheral constriction and things like that, or only in the end stage? When do you think a patient is more receptive to accepting a low vision aid?
In my view, the low vision aid is helping the patient to utilize his existing vision in a better fashion, to improve his day-to-day lives. So any patient, whatever the stage, in case even in the initial stage, even with N8 as an example for near, can be referred so that he is able to improve his life. And as RP, in case it is progressing, that point of time we can change the device according to his requirement at that point of time.
Okay, so you mean that earlier they're tuned to using or getting accustomed to using a low vision is always better. They'll be receptive.
Because socially as well as socially also it becomes easier, and for usage also they become easier for them to get used to the device.
We have one question from our online viewer. E-sight, the indications and what kind of vision improvement will a patient get with it?
In E-sight, in terms of the vision improvement, the patient, let's assume he has a vision of 660. With maximum zooming, which we have done the trials, the patient may be able to improve up to 6 by 9 or even 6.6. The difficulty with eSight is not in terms of the improvement in the vision, because the zooming capacity is up to 24 times. But more importantly, the issue is in terms of, at least in India, is about the after support. So in case of any problem, the device has to go to US, and we are not really sure. The second major issue for the patients in India is the very high cost. It will be costing nearly 8 lakhs or so. So these are the two major challenges. Third, the warranty which the company offers onto the device. So these things become restrictive in terms of number of users who may be willing for such devices as of now. Maybe in future, as the cost keeps going down, it will become more accessible and affordable for the patients.
Okay. So what's the youngest patient which you have treated, or what is the age group? You said he obviously can opt out right from the beginning. But over here, how do you get referrals, and what is the youngest patient you have treated, and how it
The youngest patient that we had actually examined was around 6 years old. The low vision aids being a subjective response for which we will be waiting. So as long as the patient can give a response, whether he or she is able to see, we can straight away go and refer and do a trial. Because based on that only we can give or suggest a device. The younger the patient, we do not have an issue in terms of offering the device. The low vision aids are going to improve his day-to-day activities. So until and unless the patient is given a trial, we cannot decide which device will be suitable for him or her.
glaucoma wondering whether how many referrals do you think that we need to bring in more people to get aware of all these things that are like a retina and a glaucoma and pediatric. Probably they should be more aware, and they keep sending you constant referral cases. I just wanted to know what kind of cases do you routinely see? The majority of the patients are with optic atrophy, or how is it? What?
So if you ask me, in my view, any patient, I mean, this I look at it as a very essential clinical tool to satisfy the patient and improve his life. So whether it is glaucoma, whether it is retina or a pediatrician, any patient whose vision is not improving to the normal level, or who is facing difficulty in his day-to-day tasks. As an example, doctor was mentioning about a patient who is a surgeon and unable to read the prescriptions or the small font. All of them can be referred, because finally the patient becomes more satisfied in terms of their day-to-day usage of the devices, and it becomes easier for their daily routines.
Can you just demonstrate these things?
Yeah.
Over here, Mari, can you hold the camera? So probably you can just name the objects which are displayed over here and the cost of it. So this is Sajida. So she is the optometrist who's actually handling all our referrals which we give from our branches. So she also takes care of contact lens, and she's also an ocularist. So please feel free to contact her in case when referring patients, you can always call up and ask her what happened and what devices the patient has been finally handed over. So I think now we can go on.
You want to tilt it?
You just use the camera.
Yes. So this is the ultrasound. This is the ultrasound. This has been developed by IIT, in fact.
Okay.
Okay. This is the ultrasound emitter as well as receiving device. Okay, which helps in terms of the patient to really make out what distance the objects are. Having two settings, one for distance as well as one for outside, one for inside. So patient can have various distances. It gives vibratory tools as well as auditory.
So what is the cost of it?
For the patient, it would be costing around 10,000 rupees. This is the 5-inch device, 5-inch video magnifier. Okay. Yeah, no, 5-inch video magnifier. Okay. Just show the zoom. Yeah. This is the simple letter writer. Many a times what actually requires is for us to understand the patient need, and then we can go ahead in terms of modifying the day-to-day requirements. Sometimes, as an example, patient required spectacle magnifier, and because he still wasn't happy with the amount of magnification. So what we did is we added this along with the dome magnifier. So when we are doing a combination, patient is getting better magnification and patient was happy. They found it convenient as well as they were able to do their own tasks.
How much would a spectacle magnifier cost?
This would be costing to the patient around 3,000 rupees.
And you have two dome magnifiers, right? One is the illuminated and one is the not. So the
Yes.
cost of that.
The approximately 5,000 rupees. Okay. These are the monocular telescopes having various zooming capacities. This is a monocular spectacle mounted magnifier. Sorry, spectacle telescope. Okay. This is the PD adjustable, wherein you can change the PD according to the patient's requirement. These are coming with fixed PD. These are the Ocutech devices, okay, wherein you are offering the zooming ability for only one eye. Now, many a times the question comes across that, okay, you are dispensing for low vision aids, but you are dispensing for only one eye. What happens, majority of the cases, I would say maybe 80% of the patients have preference of viewing through only one eye because the vision is better only in one eye. So in such cases, binocular vision has not been a cause of problem or a strain for the patient. So this is offering up to 6 times zooming capacity. In case we are going in for a binocular device, then that is offering 2 times magnification.
This is the pocket magnifier.
These are the pocket magnifiers.
It's quite handy, and I think the cost would be how much?
Around 1,000 rupees or so.
This is illuminated or non?
Non-illuminated. We have the illuminated also.
Okay.
This is the letter writer. So this is not a very difficult tool if you see. Nothing other than just black lines to help the patient to differentiate. And what it actually does is, let's take out this sheet. You can place a normal sheet, right, and take out that sheet. Okay. This is the signature guide. Okay, so the patient, where is he signing? He can place it on the notebook or the checkbook wherever requires and ensure that his signature is happening at the proper place. It improves the contrast. This is CTV. So if you see, both the object lenses are attached. So the change in focus happens binocularly. And this is the Max TV. So you can change the focus of each eye at a time.
I think this is an overall view of the various objects which we have as the low vision aids. So again, thank you again for the wonderful presentation. Our next meet will be on October 1st. This time it will be on the first Tuesday of this month because I think the second Tuesday falls on a puja holiday. So thank you all once again for participating, and see you all till then next week. Thank you. Like the